The outlook for the healthcare industry remains challenging, thanks in part to uncertainty over the upcoming presidential election and the continued changes ushered in by the Affordable Care Act. While the ACA was signed into law over 6 years ago, we now are entering only the third year of its full implementation. At the same time, many of the ACA's central tenets to push the system away from fee-for-service to fee-for-value are only starting to take shape. And this year's political rhetoric suggests only more uncertainty to come. But this central tenet of the ACA is significantly embedded now and will continue to drive behavior and activity within the industry. Fee-for-value has been a popular buzzword for many years, but it's starting to become reality. Whether you're a hospital or a home health provider, you recognize that fee-for-service incentivizes the sale of services and not outcomes. Reimbursement models are being designed by insurance companies and federal programs to focus on quality measures and efficiencies. Bundled payment programs are promoting greater care and integration and connecting the previous silos of caregiving. An example of this is CMS's recently launched joint replacement program for managing hip and knee procedures from surgery through post-acute care and recovery. It is imperative for the long-term success of all providers to understand these changes and adjust their business models accordingly. Despite the uncertainty and rapid changes across healthcare, private equity investors are still attracted to many real opportunities. These industry-wide changes driving healthcare are resulting in consolidation of highly fragmented sectors, particularly within post-acute care. At the same time, the U.S. population is aging, and medical advances are allowing people to live longer. Demand for healthcare services remains strong, though delivery of care is shifting to the lowest cost setting, and consumers are being burdened with a larger share of this cost while demanding greater quality. All of this creates opportunity for private equity investors to target certain sectors that require greater scale, investment, and improved efficiencies to survive. One particular sector attracting investor attention is behavioral healthcare, which includes everything from psychiatric facilities to residential substance abuse treatment centers. This is a sector benefiting from both ACA-generated increased insurance coverage, a clear unmet healthcare need, and state and federal legislation addressing mental health concerns, all of which is stimulating new solutions and investment opportunities. And it's not just service providers witnessing increased investment activity. Healthcare real estate, specifically related to skilled nursing, assisted living, and medical office, remains very robust. Skilled nursing and assisted living are attractive due to an aging population and a lack of supply to meet pending demand. Medical office is attractive given the shift of care delivery away from inpatient toward outpatient settings. Last year, the healthcare sector recorded the highest M&A volume ever with approximately 1,400 transactions. However, 2016 has started off a bit slower. As we look near term, we continue to see a healthcare sector that is navigating change but maintains sound fundamentals for growth and is better equipped to withstand economic cycles. In the face of uncertainty, pending elections, and secular changes, this year's question is, how active is private equity going to be?